now. Welcome, and I'm going to do a little bit of housekeeping, and then I'll do a little bit of a welcome and a round of introductions. So just to let you know again, this meeting will be recorded and it will be available on YouTube in due course. Please do use the chat function to say hi and to make any comments and chat with your fellow participants. And use the Q&A function to put questions directly to the speakers. I will be keeping an eye on the Q&A section, and we do have 10 minutes at the end, which I'll stop and have a look at the questions and put them to the panel. But do put them in when you think of them as we go through, because I might be able to try and weave them into the discussion as we go as well. There'll be feedback forms at the end of the session sent out to you, and we really do appreciate sort of any comments and feedback that you may have. Please use the hashtags hashtag Thrive by Design and hashtag Leeds Digi21 when you're talking about this session on social media. And with that, I will officially welcome you all. But there was one thing I was going to say before we get started. I realise that you might be a bit confused by the branding for this event, and I'm delighted for the first time to be talking under the brand of our new name, Thrive by Design. And you will know that we used to be called mHabitat, which was originally set up in 2014. And I don't know if many of you know this, but the M stood for mobile. And the idea at that time was to co-create habitats for mobile applications to be developed. But the team has evolved in many different ways, but we stuck with that name for 7 years. But then last year, the pandemic and lockdown led to us really sort of taking stock of who we are and what we want to contribute to the world of health and care. And so we pivoted our mission to be more focused on inclusive co-design with the aim of tackling health inequalities and ensuring that everyone can thrive. So I hope that you will agree that we now do what it says on the tin. And I'm really, really delighted that this is our very first event stepping out as a team and as Thrive by Design. We've got an excellent panel here today. And this session is really close to the hearts of every member of the Thrive by Design team, because we fundamentally believe that people are not the problem, they're the solution. And we've delivered around about, I think we were sort of adding up the other day, around about 190 co-designed projects over that 7 or 8 years. And time and again, we've seen that people who have relevant living and learnt experience provide a unique and valuable contribution. And when genuinely involved in co-design, there are better health outcomes and better outcomes all round. So here we have a fantastic panel of people who've been involved in co-designing solutions to discuss what co-design really means to us, why co-design should be at the heart of health and care. And we'll talk through some real life examples as we go and try to understand where we think the NHS is at right now and where it's heading. We'll start with a little round of introductions, and then I'm going to ask the panels a few questions, and we'll have a little bit of a conversation. And then Kirsten is going to give us a little bit of a taster session on inclusive co-design, and we'll finish up by hopefully answering some of your questions. So without further ado, I'm going to ask my panel to introduce themselves today, and I'll start with Sue, because you're on my right-hand side here.
Hi, I'm Sue Sibbald. As I said, I always say I worked in nightclub for 20 odd years, and then I quickly switched to the NHS. I worked there for 10 years as a peer consultant for those with the label of personality disorder. I now left in October, and I work as a peer consultant, working for people like NHSX and NHS Confed, and I've got a real great interest in co-production because I was banging my head for 10 years in the NHS trying to make this happen. So that's me.
And I think Sue's been quite modest there. We recently asked Sue to come and, I guess, train and support our team to understand more about what co-production really means and sort of underneath the surface. So I'm really delighted that you can be here today, Sue. Thank you.
Thank you.
Kirsten, you're next on my screen.
Hi everyone, my name is Kirsten Blackwell. I work for Thrive by Design. I'm design and delivery team manager. I'm in Leeds. I can see Leeds out of my window, so it feels very relevant for the festival today. Really pleased to be here. So my day job is working on lots of different co-design projects with Thrive by Design, and I've worked with most people on this call today. So I'm really excited to dig into some of the conversation and see where we get to, and I think learn a lot from everybody here as well.
And then Pete, you're next.
Hi everyone, I'm Pete Nuckley. I'm Deputy Director of Design and Delivery at Thrive by Design. I guess I'm responsible for our work in inclusive digital transformation and our co-design practices. And for the last number of years, I've been working with groups that the system has left behind. So poor designers left people behind, and we've been working with those groups to see if we can make it better. Thank you.
Thank you. And Catherine?
Hi, hello everybody. I'm Catherine Grace. I'm a leader in service design, user research and co-design, and I've worked with digital teams from Orange and EE through to Co-op Digital, and then I've been working in government, in local government with Leeds City Council last year, setting up emergency services in response to COVID, and this year I joined NHS Test and Trace for a little while, and then I just started a new job at NHSX. But I've got a real passion for people being involved in design in whichever way they need to be, and that can work in lots of different ways, whether it's in different areas where it's actually in the community, or whether it's in a project management team in an organisation. So yeah, I'm really excited to be here today to hear lots of different views and learn a little bit more about what people are actually doing. So thanks for inviting me.
Thank you, Catherine, and congratulations on your new role. We're really pleased to have you here as someone that's done a lot of co-design work in Leeds, so brilliant to have you. And Shelley, over to you.
Hi everybody, I'm Shelley Russell. I'm an autism project manager and I work for the West Yorkshire Integrated Care System, the NHS. As most people on this panel are passionate and integral to our work to make sure that co-production is going on. So hi everybody.
Brilliant. And I love the question that Catherine's already put in the chat about and I think this will come on nicely to the question I'm about to ask Kirsten, but she says it would love to know how to advocate for co-design as opposed to a user-centered design approach that talks to users, then designs from those talks without users, and then tests the work with users. So I think you're fundamentally getting to the kernel of what we'll probably talk about today, and around power and real true involvement. Kirsten, on that note, with that challenge, I guess in there. Could you sort of talk to us a little bit more about, what you see as co-design? And I think this sometimes is quite personal, isn't it? As well as, everybody's got kind of different take on it, and the conversation and debate is really important. But what do you see as co-design, and why is it important in a health and care context?
Thanks, Ros. I'm sure everyone else here will have something to add to my answer, and I think we probably already covered part of it in some of our introductions. But I guess I'm a fan of simple language, so if I was to really simplify this down and use as few words as possible, although Pete might beat me if he tries again in a second because he's really good with this stuff, is I'd say that it's about working together to make a new thing or make an existing thing better, and the working together thing is really key. So you're bringing everyone into the process who is affected by the problem or might need to use the thing that you're creating or be involved in the service that you're working on, and so that might be in the health and care context, it might be people that use a service, it might be their family members, their kind of if they have carers or a parent carer, if it's a young person, it would be the staff that work in that service, and there's lots of different types of staff that you might need to include in that, and it's also importantly bringing the people that kind of, I guess, ultimately hold kind of budgets and things like that into the conversation, with the idea that you're then sharing that decision making and the power to make those decisions between all of those people that are involved in that. And I guess the design part of co-design is referring to, I guess, design thinking, and going to Catherine's point, I guess there's crossover with kind of user-centered design, human-centered design approaches, but really the co-part of this is that you're doing this stuff together with everyone that kind of needs to be there really and has input to that. And the reason that's really important is, especially in health and care, this stuff is obviously really complex and it's really important and it affects people's lives in all kinds of different ways. And I don't think anyone can sort of take the sort of position of, oh, I know what's going to work for everybody that is going to interact with this thing. So it's really important to understand the sort of nuances and things that matter to different people, and then talk about those things together and kind of come up with solutions together that might kind of work for everybody to some level. And obviously there'll be competing views in all of that, but that's kind of, I guess, where the sort of power of doing this in a involving everybody is. I don't know if anybody in the room wants to come in to add anything. I guess what I've not touched upon is the crossover with kind of co-production and some of those other methods as well. Sue, I imagine you might have something to say there.
Love to be put on the spot like that. Thank you very much for that. I just think it's about people listening, respecting. Everyone can contribute. And I always say about celebrating at the end, having a big celebration, working as equal partners, and you know, there needs to be equality and diversity and all of those things need thinking about. There's a hell of a lot of, you know, this huge long list of things that you need to be thinking about. I think people have different challenges as well, whoever they are. You know, whether there's someone who's come along as a person who's using services or as a I don't like the word expert, no, I bet as a professional, we've all got our own challenges, and to notice that, and to work in a positive way, I think, and to get that from the start and build those trusting relationships, because trust is such a huge thing. Because if you don't trust each other, it's not going to happen. So yeah,
and that's not an easy thing to do, is it? When I think about the context we often work in, where you know there's timescales set, there's limited resources, there's you know complex sort of relationships that you're working with, and you know short-term projects and so on. How do you know there's real challenges in that to work with. I can see that Pete wants to come in here.
So I agree with everything everyone said. I just wanted to point out Bob's made a comment in the chat panel that says something like, I haven't got it in front of me, something like trying to do co-design after the event or after something's been made doesn't work. And I would agree with Bob. I think, though, from a sort of pragmatic point of view, we do have the service that we've got. So we do have to sometimes start in the middle. So there is ways for us to do co-design to make things better. They might not be perfect, because you're right, if we start from a blank page, it'd be better. But we can still do it to improve and make these services more inclusive. But I think the wider point's right.
Yeah, and there's a sort of another way of interpreting what you've said there, because sometimes you got, you know, it all gets sorted out and then you go, oh, forgotten to involve everyone and ask them what they think of this thing. And when really all the decisions have been made, there's the things being made, and it's tokenistic at the end. Does anyone else want to add anything before I move on? No. So I'm going to ask Shelley and Sue. You were talking about you know, the positive approach, and I'd love to know from you if you've got any like positive and really good practice examples of this really working well, and what is it about those examples that worked well, you know. So I'm trying to sort of draw out some lessons that for us here, but also for people who are listening on how to do this in the right way, or one right way. Sue, do you want to? Oh no, Shelley, you go first, because Sue's already had a go.
I was going to say, do you want to go? So it's up to you. I guess I'm trying to think about the project that we worked with yourselves on with some young people and some parent carers that were neurodiverse. And I guess, you know, what Sue said previously around, you know, respect and valuing people and hearing people's voice, all those really important foundations. I think there's something else around having options and it being accessible. So there's something around making co-design and co-production and engagement and all of those things in a way that people can access it to what meets their needs and the service needs. So I guess there's for me, it's a two-way partnership. It's about being transparent, so that trust can only be built if you have transparency, and you may not always be able to do what somebody may want you to do, but it's about being honest about that and knowing where the boundaries and the perimeters are. So I think for me, I'm not very good with digital speak, and I don't have a clue about digital stuff, but I learned a lot with our project that we did. And I think some of the really good parts were around people having different options how to access. So some people could have their voice heard in a survey. Some people could join virtually and access a workshop. People could do that with a video on, with a video off, with a chat box without. People could have one-to-one interviews. So it was about giving people real choice in how they could interact and communicate, and the richness that we learn from that. You know, I can only see what I know through my lens, and that's through my experiences of what I've learned. But what we need to do is understand it from everybody's lens to try and make that end product fit for purpose, I guess. So I don't know if that answers, is that?
Yeah. I mean, yeah, you've just basically drawn up a list of principles that are brilliant, actually, I think. So I've got trusted relationships, respect, hearing people's voice, options, accessibility, thinking through accessibility, transparency around boundaries, and so on. Really, really important stuff. Sue, did you want to add anything to that?
I did. I wanted to do a quote I did from Twitter in 2018. And the quote goes, this is me, it was during National Co-Production Week. This is a thing, it's just been. But I put, true co-production is not asking me to come along and tell my story, nor is it telling me what you think of your great idea. It's about me being there from strategy to delivery, and you need to be aware of the power imbalance. And then I quickly want to tell a quick story about a place in Sheffield called Sheffield Flourish, who I started off, Ros was there, Ros was the boss. Anyway, it was brilliant the way it was set up, because it was set up from strategy. We were all bought in. So I was talking about strategy to delivery. We were all bought in, and we had name tags we could make ourselves, but we didn't say what we were or who we were and how great we were. And we just had nice little star things, name tags. And then we were all bought in, and we were asked, what do you think digital is? And I always remember one guy saying it was his digital radio. That's what kept him well. And you know, it was a brilliant session. Everyone just joined in. It was really well facilitated, which is important as well. And no one felt excluded, and everyone was involved. And now the impact, I was going to ask for impact. The impact was, because this is what I call more large scale co-production. The impact has been that it's now a flourishing mental health hub with, you know, it's online, but it's blended offline as well, which is things you talked about, Shelley. So you can go to gardening groups or other sorts of groups, music, football, but there's online stuff like a mental health guide, and they did some work around suicide recently. So for me, that's huge impact. And then smaller scale impact, you can just have, like I did, work with a psychologist and created some groups for people with a label of personality disorder and their families. And the impact is pre and post testing, run for 10 years, and it's, you know, statistically significant changes for people in their lives. So big, large scale, small scale, and there are lots of positive things out there, but there's still a way to go.
Yeah. There's something we were chatting earlier in the green room, and Sue was telling us about an event that she's just been to in Sheffield that was all about co-production. And as you were describing it, I was thinking, you know, one of the things about it is that it was fun, it was social, it was fun, there was food, you know, it felt like a human thing to do. And I think that's really important. And some of the most fulfilling things I've been involved in at work and out of work around developing stuff for health and care have been fun, and have been sort of time spent with really good people. And I think another important thing to note is about the importance of people feeling valued in all of this and heard and listened to, and that, you know, they're making a difference, that their contribution is meaningful, and it means some, you know, the end result is meaningful as well. So yeah, so just a couple of things to add to that, really. Now, so that's sort of a very quick whistle-stop tour through sort of our interpretation of what co-design is and some of the important principles and some examples of it happening. And I'd be really interested to pick some of so Pete and Catherine, if you don't mind me saying, so have been at this for years and working in a health and care context. And I'd be really interested to learn from you, how far do you think we've come along this journey in health and care? And where do you think things are heading to from here on? Catherine, do you want to go first?
I remember a workshop that Victoria Besson ran in maybe 2014, and literally we had a creative scribe to do some illustration of what was happening, and we just bundled loads of people in a room that were interested in digital, and we didn't kind of organise so much about the workshop, but we just asked for people's opinions and then asked people to gather in small groups and then see where they got to. So everybody was kind of talking to each other and progressing ideas, but it wasn't necessarily, it was about what it could be in the future. And so it's kind of speculative working. So you get something as broad and as kind of, we're just looking at a broad picture and looking at initial ideas to, you know, how does my care work in this particular clinic? I'm a diabetic, and then this is happening, and there are, you can use co-design a kind of a blue sky level for what could be, so for innovation, and you can use it for how are things actually working on the ground here and now. I did a project, I created a startup with, won some funding from York City Council and the NHS over in York in 2013. And we looked at how people communicated about their own care. And so I started off doing some research on that. And what I did then was did research on the ground, stood outside ASDA for a whole day and asked people about their care, and asked people to did a questionnaire and did about how they thought about digital and what the potential was of digital, and like on the ground research with real people and meeting a really broad spectrum of people all in one event, not just being based in a hospital or a clinic. And still to this day, it's the most broad research and really valuable research for health that I've ever been involved in. So you can be very you can be, and as when I've done co-design, not so much in a health environment, but in a business environment, when you're specific about what you want the outcomes to be, whether it's the community have developed, this is what we need to do, or whether it's the business that's organised, this is what we want to do, the more you can design these workshops to work to whatever outcome that you want. So that people have become very sophisticated with co-design over the years, and the people in Australia, like there's this book here, I'm not getting any money for promoting this, but Kelly McKercher has written a really good book about co-design and created a little book on a model of care for co-design, how things work, and different ways of working when you kind of professionalize co-design. So you can go that far, or you can take the opposite approach. So Joseph Rowntree Foundation have done some really good thinking and work on this in terms of working with people in poverty, and they've kind of done an overview of co-design, and they'll say we can start something because we think it's a good idea and we want to save the world, and that's kind of an illustrative. And you host a workshop and you invite people. And there's a second kind where people have kind of got used to what you're doing and they kind of know what to do. And then they kind of try designing together. And then there's a third kind where it becomes more inclusive, and they're starting to take more of a lead role in the organisation of the workshop and the work. And then the fourth is when the communities that you're targeting are in the driving seat. So there's four kind of areas, four ways of doing co-design. And just like Sue was saying, progress just happens at the speed of trust. And having the skills to do co-design and to work together is really important. So it's not just asking for your opinion, it's kind of learning to work in a structured way and to help with whatever the thing is that you're designing. So I've thrown quite a lot out there, so I'll pause there. That's for Pete, did you want to
Yeah, so thanks, Catherine. So another Catherine in the chat panel early doors talked about user-centered design versus code design, I guess. And I think the health systems, not just the NHS, hasn't come far enough. It's been a big slog just to get people in the system to talk to end users or patients or humans or whatever term we want to use. That's been a big slog of our sector for a while. I remember when we were doing some work with a few years back with, so this be two years ago, with a homeless community. And we went and sort of just stayed in this homeless day centre for a little bit, just to chat to people about their life and circumstance. And that seemed mind-blowing to the NHS at the time. So just the fact that we're talking about at least talking to people seems like a big step forward. But you're right, other Catherine, about user-centered design is still this NHS way of going, we'll talk to some people and then the clever folk will go and sort that out in an office somewhere. That's the way the NHS is set up. We've done it with doctors and nurses and so on. They're the clever people and us sort of plebs go in and chat to them, right? I love doctors and nurses, but that's how it's set up. If we do co-design properly, they are involved in it and we don't bring them to the posh offices with croissants and toast and all the stuff that toast isn't posh, Pete. We go to where they are with it, right? So there is big challenges about this. And I think the NHSX at the moment is still pushing this idea of user-centered design. I think there's another evolution where they get to co-design, but at least they're starting to talk to users, and that's the main thing, or patients or people, whatever we want to say. So that's the main thing. And then someone did ask quickly, what's the biggest barrier to co-design? The biggest barrier is proving its worth, because it takes time. And I think you can go out and do a really good co-design kind of process in like 48 hours and then prove some value for that, and then say, right, we need it bigger and better and bolder from now on. And I think that's what we need to be doing, is Googling, I don't know, refugee communities in the middle of Leeds, right? Ring them up and say, can we have a chat here? And they'll always say, yeah, they always say yes. Even though I'm a Scouser, they answer the phone and trust me somehow and say yes, because they want services to be better. So you can always access these people. We seem to get in our own way in the health sector about it. So I don't think there is barriers if we just sort of, what's the saying? If we don't ask permission, we ask forgiveness, I think, just to prove its worth first. It's my view.
Thank you, Catherine and Pete. That's really useful kind of overview, really, and really interesting to hear your journeys as well, I think. I will come back to that question about barriers, but what I was going to do next is hand over the reins to Kirsten, who's just going to run through a very sort of quick taster kind of inclusive co-design exercise with us, just for a bit of fun, really. So I will hand over to you.
Thank you. So thanks, Ros. So first of all, I should say that Ros gave me a nice challenge today in saying, oh, let's do a taster for 10 minutes on inclusive co-design, because it's easy, right? So I was trying to think what would be the most valuable use of those 10 minutes. And we could talk about all the different steps and things, but I thought maybe what we could do is just have a bit of a think individually. It's a shame we're not in a group to talk about this with all of you participants who we can't see, but please use the chat and interact with us as much as you can through this session. And if you've got any colleagues or, I don't know, a dog next to you that you could talk to, that's fine as well, because co-design is all about talking to people and working through some stuff. So I'm just going to share my screen. What you might want to do if you have a piece of paper to hand is grab one, or you could just do this without a piece of paper, don't worry. We've got some post-it notes. We all like post-it notes. Ros, can you just give me a thumbs up if you can see my screen? Yeah. Thank you. Let me just press the present button. So I guess when we're thinking about the design process, these are some of the sort of steps that we might take, and in some of those resources that you'll Catherine's already mentioned, I think we've seen a link go up, you'll see some of these words, or you might already be aware of them. So I guess design process, you work through these kind of steps, and it's an iterative thing. So it's all about understanding the problem, understanding what people need, to define that problem, come up with ideas for solutions, things that might work, test them out, and then go back to the drawing board, because inevitably you'll probably find loads of things that don't work, and you'll need to make it better. And the co-design part, as we said before, is doing this process with people. So what we thought we'd do today, instead of running through, I guess, these steps, is sort of have a think about what you could do to get to the starting point. So before you get into that understand process, and think about some things that you could do to work in a more of a co-design way. So a little bit of an activity. So if you have a piece of paper, and I can't see any of you to know whether this is a problem or not. So if not, just maybe have some thoughts in your head. So you could split your page into 4, or just get 4 post-its. And want you to think about a problem that you know about. It could be something in your work, it could be something in your life if you're struggling to think of something, and just write down a couple of words of something that's not working within your service or within the way you do things. It could even be something just within the way you work with your team, if you're looking for an example. And this is about thinking of, so this is starting from the place of going, right, there's a problem, not going, actually, there's a solution I want to try and fit in here. So you're trying to start from that space of what is it that we need to understand and look into, rather than starting to jump straight into what would make this better. So once you've got that, and don't worry if this is very quick, so don't worry if you want to come back to this later. What's really important then is you start to think about the who. So who are all of the people that are impacted by this problem? And so going back to some of the things we talked about today, is that people who use your service? Is it some of the people in their life? So a carer perhaps. Are there staff involved? What kinds of staff? Is it clinical staff? Is it estate staff? Is it people that work on the front desk at a particular site? And this is obviously a process that could take quite a bit of time, but if you just kind of start to think about who it is that is impacted by that problem, involved in that problem in some way. And I guess just to give a bit of an example, so Shelley talked before about a project that we've worked on recently, which was around looking at how people with communication needs, so perhaps people, autistic people, or people with other neurodiverse needs, how do they communicate those needs to health services and other services? So that was kind of, we knew that it's not always very easy for that to happen. We knew that services don't always know what adjustments can be made. So that was kind of our starting point. So then we had to think about all of the people that impacts. So it's the person accessing the service themselves. This was in the context of children and young people, so there were parent carers involved. And then when we got to the service part, that just exploded for us, because we kind of thought, actually, there's so many places where people need to interact and may need to sort of convey their communication needs. So we thought all the way through from kind of dentists through to hairdressers and all sorts of other people that may need to interact with that. So once you've got a bit of a list of kind of who, what I challenge you on then is to think about, is there anyone else that you might not have thought of, and how could you potentially refine that list? So could you go and talk to some colleagues, or talk to some of the people that are already on that list, and find out who else they think is involved in this, and try not to just work from kind of your one perspective, as we talked about before. Try and build that list of who with as many people as you can. Just bug everyone you can find is usually a good way of doing that, and try and understand that a bit more. And then once you have a few ideas of who is involved, then you might want to start thinking about, well, how could we perhaps maybe move towards doing this in more of a co-design way? I'm pausing a little bit because I'm unsure if I'm giving enough time, and it's very odd not being able to see everyone in here. So I'll just do a little awkward pause for a minute. Ros has put her camera back on for me. Thank you. So in this, you might want to think, are there any particular people that you've identified in that top right corner who may face barriers to be involved in something? So Shelley kind of talked about this a little bit before. So are there people that may need to be given sort of different options and how they could be involved? How would you find out about what people need? Could you go out and talk to some people and try and understand what would work better for them? How could you work to reduce barriers and bring as many people in as possible? What you might need to think about in terms of practicalities. So we've talked a bit about some of the events where this has worked well, where there's a bit of fun, and food is often something that can draw people in. So kind of practicalities wise, if you can do something in person, how might that work? What kind of setup might you need? How can you make sure that everyone can contribute in a way that's going to work for them? And this part isn't necessarily easy, and it's probably not something you're going to get down in a couple of minutes that we have today. But I guess it's just starting to think about, how can you make a process like this work for all of those different people, and what might you need to think about? If anyone wants to come in with anything to add to this in terms of things you might have thought about for when you've been running co-design or co-production processes, feel free to.
I've got something. I'm interested. So when it's, you know, a design or a team or whatever sort of writing this, how do you know who you don't know about, who should be there? You know, there's a sort of there's a next step to it, isn't it? This kind of a real challenging question for you, for us. So I often think that we go, oh, these are the people that use services. Well, what about the people who aren't using those services, who might need that support?
Yeah, definitely. And I think that's where it's kind of a stop and pause and be really humble about what you think you know, and where that has kind of come from, I guess. And that's where I guess talking to people from different contexts is really helpful. So I don't know, if you were tackling something within the health space, talking to some staff that are kind of like working with people day in, day out, they may be able to identify some groups of people that we need to talk to, talking to a community organisation, maybe things like that. So there's lots of ways of kind of, I guess, trying to find that information out, and also potentially reacting to that as you go through a process. So you might get to a place where you've started all of this and you think, actually, we're not speaking to this person, and that's really important that we bring them in and bring them in at a later stage, and be really humble, I guess, about kind of where we've kind of got to and what we do and don't know.
Did you want to add something? Sorry.
Me. I think we did a piece of co-production in the NHS, which was one really good thing we was involved in, and getting other people along. We actually had we actually got about 80 people along. So I think sometimes at scale, you manage to get more of the right people along that you might need, who are interested in that. It was around personality disorder and services. And we had food, and we had fun, and there was cheese. And you know, it was getting, I suppose, at scale and getting people. Sometimes I think it's that thing that we won't invite them because they're difficult. And it's getting the difficult people along because they have got so much that they can contribute. People, you know, people shy away. I think people probably saw me as a bit difficult, actually, because I've questioned about what's going on. And I think it's good to listen to people. And sometimes at scale you can do that. But knowing where people are, and that's getting into that community. Because I always think about co-production as well. It should end up in people's communities, where they're at, and you know, hopefully the integrated care systems might help with that. I don't know yet, but to be in the communities where people are at, and knowing what they need within their small communities. Yeah,
and at its very best, this is a sort of shared purpose, isn't it? Right from the very beginning, something that we want to work on together, and recognizing expertise and insight and value in all the sort of different roles around. So it's sort of I think that's what happened, I think, with Sheffield Flourish, that there were a number of people who might have been working in services, might have been receiving services, might have been involved in digital stuff, who got together, who cared about the same thing. They cared about improving the context for people living with mental health illness in Sheffield. So there was a shared purpose there, and they all wanted to contribute what they had to making something together. And I think that's sort of like, to me, and there are loads of complexities underneath it all. And I'm a little bit, I don't use the word co-production, because I think it is the ultimate in this, and there's an element of power dynamic and all that sort of thing that's very difficult. And we are never in this country working in a context where everybody's got equal power. And we need to recognise that and be honest about that. But also, I think, seek to sort of try and change that, but recognise we're not in perfect conditions.
I definitely think so. Yeah, I definitely think so. I think the NHS, having worked in it, has got quite a way to go, really. There's some brilliant people in there who do want to make changes, and there's small pockets of really good stuff. But I have to say, I think a lot of the really good work's going on outside of the NHS. I'm going to say that might be controversial, but in places like Thrive by Design, oh my God, that right, and Flourish, and people who are satellites, if you like, because they can, because they're smaller and there's a will to do it. During COVID, I think the power was sucked up. There was things like Gold Command and Silver Command and Bronze Command, and there was no command from people using services. So yeah, anyway, I think the NHS has a way to go, and its patient and public participation policy says, I'm going to read this. Can I read it quick? NHS England will work in partnership with patient and public to improve patient safety and patient experience, health outcomes, supporting people to live healthier lives. But it needs to do it. It said it in its policy, but it just needs to get on and do it more.
Yeah. Well, there's a duty to involve in all sorts, isn't there? There's a lot of kind of, there is guidance and legislation and all sorts behind all of this. Kirsten, do you want to finish up, and then we'll come back together? And I think there's some really good questions and really good comments, some challenging comments in the chat. And I really wish this was an open conversation where we could all see each other, actually. Perhaps that's what we'll have to do next time if we can. Yeah, but I'll hand over back to you, Kirsten, to finish up.
Yeah, I agree. I think being able to interact with everyone would have been great for this session, but we'll do that next time for sure. So yeah, the last thing, I guess, just to sort of think about and maybe to get a bit of interaction going. So I guess maybe either through thinking through those questions or just kind of reflecting on all of the wonderful insights we've had from the panelists today. We wondered if you would share on the chat, or you could just scribble it down and keep it to yourself if you wish to, one small step you could take within your context to, I guess, move towards working together with people on this stuff, towards a more co-design type approach. So it would be great to hear kind of some thoughts there, and please do continue with the questions and comments as well, and I'm sure Ros will pick those up.
You're giving me a good challenge back there. Whilst people are doing that, I am going to sort of link back to a question that was posed earlier, and Pete started to answer, and I think we were sort of coming onto there too in some ways. And it was from Andy Jenkins, and what he was asking were, what are the barriers to inclusive co-design? And I think there's so many ways you could look at that challenge, but I don't know if anyone would like to come in and talk about what they think the barriers are, and I think we'll probably see it from different angles.
I'm happy to rattle off a load more if you want some more.
Yeah. Shelley, were you going to say something, and then Pete, you come in afterwards, if that's all right?
I can do. I kind of agree with when you first asked it, my initial answer was the same as Pete's. It was time. And I think it does take more time, it takes more effort. And, you know, I get it when you're really, really busy to take that time out that you don't feel like you're having the day is hard for people. And I also think that some people would like to do it better, but there's a lack of confidence. And I think having my kind of neurodiverse hat on, thinking people are often a little bit nervous of, you know, what language should we say? How should we ask things? What should we do? And so is that a barrier in itself, that even if you did have the time, you feel a little bit stuck because you're not confident in doing that?
Absolutely. Time and confidence. Go, Pete.
I think one of the barriers that we've definitely had over the last 15, 18 months is we were unable to go where people are. So by definition, we'd be excluding people if this was a workshop, right? So that's no good. And the second thing is, when you don't have the time or the money to try this type of stuff out, is you revert back to talking to things like patient participation groups who look a bit like me, but slightly older. And it's the same group of people who have advocacy of themselves, who have the confidence to come forward. And what we're trying to say is, I haven't seen a perfect example of it, least of all from us, but every person you talk to, there's a more invisible person behind them somewhere. And we should be constantly stretching ourselves to find those invisible people. And by the way, their invisibility is our fault, not theirs. But we should be doing everything we can to reach further and further into these communities to talk to them. Because if we design for those who are most excluded, then it will work for everyone. That's kind of the working theory. So noting that it'll never be perfect, but really just pushing that way to go. If I've spoke to you, you were willing to speak to me, that's good, but there's someone behind you who isn't, someone behind you and isn't. And finding them route through takes a while and it's hard work, but we think the stuff you get back's better. So
go, Catherine.
So barriers. I did a little bit of work in Leeds with dementia services a number of years ago. So I was a family carer for my father with dementia in Leeds, and wanted to understand how services worked in the city, and got involved in a few community or the boards for the city. I got invited to a couple of things. And I set up a workshop with what was mHabitat then, and we got the Alzheimer's Society, we got the clinicians involved in memory care, memory nurses, the people at the mental health emergency groups that come out, the community groups that come out for emergency situations, domiciliary care. We got everybody who was involved in dementia care as a whole thing for life together. And we put together some stories, some case studies of what life in Leeds was like when you're doing dementia care, whether you're a patient or whether you're the carer. And it was important to look at it from both perspectives, because as one person's ability disappears, the other person kind of picks up. So the carer is very, very, very much involved in that scenario. And sadly, the feedback at the end of it was, so my father got a diagnosis in 2009, and we got the service support that we did then. But by 2014, 2015, the services that we had available to us in the city had disappeared, and more people have been diagnosed with dementia, and so therefore there was more and more work to be done with the same people, the same resources, and so when it comes to, so I was kind of, and we came up with some ideas of different things that could help us in the city, and unfortunately, because there was so much pressure on the system, the answer was, well, Catherine, have you got the time and the money to do something? Because you know that you need it, and you know what's needed to one level, and you are a user-centered design person, and you understand user research, and you understand digital, and you understand care. So you'd be in a perfect position to do this, but there's no money. So, and sadly, the people who had been so helpful with me, giving me the support I needed as a family carer, they said we wouldn't be able to support you in the same way. And so it's really, really challenging. So the barrier was time for the clinicians. They were being expected to meet the needs of more and more people with less and less. resources, or proportionally less and less resources. And then, so that was the barrier, was time, and that they had. We sneaked the workshop into one of their normal business as usual meetings, because as much as there might be challenges and we'd like things to be better, there's a heck of a lot of collaboration that goes on in this city between different health practitioners, despite the systems. And they know that, so if they all get together, if one of your family members gets a dementia, an Alzheimer's diagnosis, there is a whole community of people around who then they know who you are, and the Alzheimer's Society support and Carers League support, and that collaboration just naturally happens. And so when we talk about co-design, they're co-designing on their feet. So that's happening really richly, but we've got to be careful that we don't lean too much on the power of community and the power of the will to collaborate, and the time and the money to collaborate. And the other things that stop co-design happening are, so I've been in the design departments and in the project management departments within these systems, is the brief JFDI. We're in an emergency, we've just got to get it done. So when I was at Leeds City Council last year, even though we've got to get this up and off the ground and out, and publish this online form to enable people to do certain things online with the council. As a team, we involved users and involved people from the city by listening to the calls and speaking to the call centre team at Leeds City Council, so that as much as we hadn't been to see the people, and we couldn't do face-to-face stuff, and the time frame didn't allow certain things, the user-centred design team in Leeds City Council were able to listen to the calls, speak to the customer services people and say, what are you hearing? How are people describing things? What do you, so the government might describe a thing in a certain way, but we need to normalise and make the language really everyday so everybody understands it. And so we got a lot of user insight that way to be able to design the services that we did at speed. And I mean within days, having to raise the service within 5 days and pop it up online and make it all connected and accessible so you could apply for different benefits and things. And then and over time, when we did that research, and it literally took 4 hours, 5 hours to do that, because we were the luxury of having that customer services team and access to the calls, to listen to the calls. And other people like Red Cross last year were going, we wish that we had access to the telephone calls to be able to hear the telephone calls, because in an emergency you need as much insight as possible. And yeah, the other dimension was over time you listen to people, but you speak to people today, and I sort of like we did some research in kind of April time last year. We redid the same research 2-3 months later, and the people's needs for the same services have changed, because it wasn't just, oh my goodness, what we're going to do about COVID. It was, and this health situation, that health situation. It was, what we're going to do now that actually this money's run out, and we've spent that money. What are we going to? So financial needs have kind of become more important. So when you're in the system and you're trying to kind of reach out and understand what's happening within sensible timescales that we're all kind of tied within. I know that at Leeds City Council, the user research team have been really grown, and are really using those opportunities to hear. And then there's another area of work called citizen engagement, and I know that that's a slightly different thing. And then I know that the adult social care team, the adult health team in Leeds City Council, are using asset-based community development practices. So, and this is where you're coming at, and it depends on what the project is as to which way you come at it. So, not everything is going to be community-based, and not everything is going to be service system-based. So there's lots of variations of how you do this kind of stuff. And I can absolutely hear that. I've been on the front line. I've seen what it's like when the services fail you, and you're reliant on your community in this city, and I know what that feels like. But equally, we've got to kind of use to bring the best to both ends of the spectrum. So,
thank you for that really incredibly wide and varied and rich insight, Catherine. There's so many things that could pull out of that. I'm going to hand over to Sue, because I know that you've been waiting to add your penny's worth.
I'm just going to say quickly, giving away of power is a barrier, because people find it so hard to give power away. It makes them feel uncomfortable. People like to be in control, and so giving your power, your personal power or your positional power away to people who might be using services, or the carers or the families, is a really difficult thing to do. I think sometimes it makes people feel really uncomfortable. And then just really quickly, I've used this term before, but I think when people are bought in, they're bought into a structure like the NHS, and as I say, everything's NHSized as soon as they get their hands on it. And I think, like, for example, we've been bought in and then we're shown PowerPoint after PowerPoint after PowerPoint, because that's what they do in the NHS, and it's just not right for people who are coming in from a different angle, you know. And maybe the NHS should stop showing PowerPoint after PowerPoint after PowerPoint anyway, but that's it. That's all I wanted to say.
Yeah, let's stop showing PowerPoint, have more food, more cheese. So there's a couple more questions in there that I'm dying to get on, but I can see that we're running out of time, and it's been just, I am going to watch this back, because it's been so informative and wide-reaching, and there's been some really brilliant comments made and questions in the chat. What I might do is perhaps work with Kirsten to respond to some of those questions, and maybe we'll do a little blog and a sort of, you know, a response to some of the questions we haven't covered, because there's a really important one in there about how do we change the fact that co-production or co-design often excludes people with learning disabilities, and I think that one really needs a good looking at. And I do hope, if you're working for, or if you're involved in LYPFT, we are hoping to be able to actually work with the Learning Disabilities Service on a piece of inclusive digital transformation. So we might be able to sort of talk to you about that. Ben, so, and then there was another brilliant question around, which I think we started to cover, but just very quickly, around the challenges involving people throughout the process, you know, and how do you overcome that? So, you know, sometimes, and I know we've had sort of discussions about how do you involve people, how do you get people involved, and how, you know, sometimes it's a long process, isn't it, the development of a digital tool or whatever. So, you know, how do you keep people involved? So there's something like that. So I don't know if you want to, I'm going to do a sort of quick fire round, and you can either respond to one of those questions or just give me your sort of final kind of wish, if you like, for how we might get health and care systems of the future to really take on co-design, and what's the one thing that you think that we should really push for.
I don't mind going first, Roz. I think there's something about us making sure that we don't make this in itself inaccessible, in the sense that I think we have conversations all the time with really wonderful people working within the NHS or within voluntary community organisations that are doing co-design, and they don't call it that, and kind of they're working with people to understand how it works for them and what kind of needs to change. And I think sometimes there's something about some of the terminology, and we've used lots of different words just in this call, that makes, and maybe that goes back to your point, Shelley, about people then not feeling confident enough to maybe take that step forward, and if we could reduce some of that might help.
Go, who wants to go next? Got 1 minute.
I can go. If I had one wish, it would be that us and our colleagues could do more of these sessions with people who absolutely disagree with us, not with people who sort of are interested and feel like it's the right thing to do, because someone somewhere is blocking this, and I want to talk to them, because, you know, they'll be doing it for a reason that's altruistic. They won't be just trying to block it. So I'd like to talk to people who completely disagree and want to shout at me about it.
Good plan. Does anyone else want to add anything for? Good, Shelley.
Wanted to come in. I guess for me, it's about being open-minded to learning. So that, you know, we've done things and we're never always going to get it right, and there's always going to be a new way or a new thing or a new person that shares something. So I think just, and I know it's a bit of a cultural shift, I guess, about being open. A bit what Sue said, to drop the power balance, and just being open to listen, really actively listen and learn from people.
Can I say one word? Training.
Yeah. And Catherine?
I've got it written down here, having the skills to do this kind of stuff, which is what I didn't mention, the Global Service Jam and the Global Gov Jam that have been initially kind of kicked off in Leeds in 2011 and has been going ever since until lockdown. But giving people the skills on how to do this kind of stuff. And but I think what I'm seeing now is what my wish would be is to try and build a shared language that understands, you know, we need to understand each other's point of view, because there are lots of people in the NHS that want to do co-design. And I went to a talk a conference last week called Service Design in Government, and there was a big chunk of it was all about co-design. And there were lots of people in agencies and in government organisations and in the NHS all attended that. So it's not being talked about, and it's not being explored. But we need to have a shared language, and I guess it's different languages in slightly different places, based on, you know, what the area of focus and the kind of activity you're involved in. Because, you know, if I said you're going to co-design the fine details of a digital system, you wouldn't give that to your granddad, would you? But you want the implementation of what they need out of it is really important. So it's kind of understanding how our different jobs fit together. But I think trying to build some form of shared language and doing it in the reason why I did the dementia project, it was just, I just want just one step at a time. Don't try and do everything at once, and just start small and then build up.
Brilliant. Thank you so much, everybody. It's been a really, really interesting conversation. I am going to listen back to it because I think there's a lot of really useful stuff in there. The comments have been really interesting as well. Some good challenge in there, some great questions. And thank you so much, everyone, for listening. I'm not going to forget that little soundbite. I think it was you, Catherine, who said progress at the speed of trust. I think that's one of the most important parts of this, because this is about human beings and fellow human beings interacting, building relationships of trust and making the world a better place together. And I'm going to leave it there. So thank you so much, everyone. Yes, that's it. End of